1. Which cranial nerve is primarily responsible for facial expression? A. Trigeminal V. B. Facial 7. C. Glossopharyngeal 9. D. Vagus X. 2. What is the most appropriate initial step in managing a patient with active bleeding after scaling? A. Apply a cold compress. B. Instruct the patient to rinse with warm salt water. C. Apply direct pressure with gauze. D. Wait and reassess in 10 minutes. 3. Which structure anchors the tooth to the alveolar bone? A. Dentin. B. Cementum. C. Periodontal ligament. D. Enamel. 4. During an intraoral exam, a white, raised lesion is noted on the lateral tongue. What is the best next step? A. Document and reevaluate in 6 months. B. Recommend salt water rinses. C. Refer for biopsy. D. Prescribe antibiotics. 5. Which vitamin is essential for proper collagen formation in gingival tissues? A. Vitamin A. B. Vitamin C. C. Vitamin D. D. Vitamin K. 6. What is the main purpose of using disclosing solution during patient education? A. Detect subgingival calculus. B. Identify plaque accumulation. C. Highlight carious lesions. D. Measure sulcus depth. 7. Which instrument is best suited for detecting interproximal caries? A. Periodontal probe. B. Shepherd's hook explorer. C. Scaler. D. Curette. 8. When should hand hygiene be performed during patient care? A. Only before gloving. B. Before and after patient contact. C. Only after removing gloves. D. Only when visibly soiled. 9. What is the most likely cause of generalized gingival enlargement in a patient taking phenytoin? A. Hormonal changes. B. Medication side effect. C. Poor oral hygiene. D. Vitamin deficiency. 10. Which anatomical landmark is palpated during an extraoral exam to assess the TMJ? A. Coronoid process. B. Condyle. C. Zygomatic arch. D. Mastoid process. 11. Which of the following best describes a Class II malocclusion? A. Maxillary teeth are lingual to mandibular teeth. B. Mandibular teeth are distally positioned relative to maxillary teeth. C. Molars are in perfect alignment. D. Mandibular teeth are mesially positioned relative to maxillary teeth. 12. What is the appropriate action if a sterilizer shows a positive spore test? A. Continue using the sterilizer. B. Rerun the test and document results. C. Remove the sterilizer from service and investigate. D. Increase sterilization time. 13. Which fluoride application method is most suitable for a high-risk adult patient? A. Fluoride varnish. B. Fluoridated toothpaste. C. Fluoride rinse. D. Fluoridated water. 14. What is the recommended angulation for scaling anterior teeth with the Gracie 1-2 curette? A. 0, 15 degrees. B. 45, 90 degrees. C. 70, 80 degrees. D. 100, 110 degrees. 15. Which condition is characterized by a cobblestone appearance of the buccal mucosa? A. Oral candidiasis. B. Lichen planus. C. Inflammatory papillary hyperplasia. D. Fordyce granules. 16. What is the primary goal of periodontal debridement? A. Remove enamel defects. B. Reduce inflammation and restore tissue health. C. Whiten teeth. D. Restore occlusion. 17. When should an ultrasonic scaler be avoided? A. On patients with orthodontic brackets. B. In patients with communicable diseases. C. On patients with demineralized enamel. D. With patients who are pregnant. 18. Which radiograph is best to evaluate interproximal caries in posterior teeth? A. Periapical. B. Panoramic. C. Bite wing. D. Occlusal. 19. What does the term iatrogenic mean in dentistry? A. Originating from natural causes. B. Resulting from dental treatment. C. Inherited through genetics. D. Occurring due to poor hygiene. 20. What does the Miller Index assess in dental hygiene? A. Tooth mobility. B. Bone density. C. Gingival recession. D. Caries risk. 21. A patient presents with 6 mm pockets and no bone loss on radiographs. What is the most likely condition? A. Aggressive periodontitis. B. Gingival enlargement. C. Chronic periodontitis. D. Periodontal abscess. 22. Which term refers to the normal horizontal overlap of anterior teeth? A. Overjet. B. Overbite. C. Open bite. D. Crossbite. 23. Which factor most contributes to dental caries development? A. High protein intake. B. Low saliva flow. C. Frequent brushing. D. High calcium intake. 24. What is the ideal time for sealant placement after tooth eruption? A. Immediately after eruption. B. 1 year post-eruption. C. Only when decay is visible. D. 6 months after eruption. 25. Which disinfectant level is required for semi-critical instruments? A. Sterilization. B. Low-level disinfection. C. High-level disinfection. D. Intermediate-level disinfection. ATDH. The ATDH, or Admission Test for Dental Hygiene, is a standardized assessment used by dental hygiene schools to evaluate prospective students' readiness for the rigorous academic and clinical demands of the dental hygiene program. The test assesses a candidate's knowledge in key areas relevant to dental hygiene practice, including anatomy, biology, chemistry, mathematics, and general health science concepts. It also evaluates reading comprehension and critical thinking abilities, ensuring that applicants have the necessary cognitive skills for the program. The ATDH is designed to help schools select qualified candidates who can succeed in both the theoretical and practical components of the dental hygiene curriculum. Successful completion of the ATDH is often a requirement for admission to dental hygiene programs. Here are the top 5 beneficial uses of the ATDH. 1. Evaluation of academic readiness. The ATDH assesses a candidate's readiness for dental hygiene programs by testing their foundational knowledge in subjects such as biology, chemistry, and general science. This helps ensure that students are prepared for the rigorous coursework and practical skills required in the dental hygiene field. 2. Identifying strengths and weaknesses. By providing a detailed assessment of a candidate's strengths and areas needing improvement, the ATDH allows prospective students to better understand where they may need additional preparation. This information helps guide further study and academic planning before entering a dental hygiene program. 3. Streamlining the admissions process. The ATDH serves as an essential tool in the admissions process, helping dental hygiene schools identify the most qualified candidates. It provides admissions committees with objective data on applicants' academic abilities, ensuring a fair and effective selection process. 4. Standardizing applicant evaluation. With its standardized format, the ATDH allows for a consistent evaluation of all applicants. This helps eliminate biases and ensures that all candidates are assessed under the same criteria, promoting fairness in the selection process for dental hygiene programs. 5. Supporting career readiness. The ATDH tests skills that are directly relevant to the practice of dental hygiene, such as critical thinking and problem-solving in medical contexts. Passing the test indicates that candidates are ready for the challenges of a dental hygiene career and are well prepared to succeed in both the educational and professional aspects of the field.